Good afternoon, everybody. It's me, Dr. C. I'm a medical oncologist at the Parkway Cancer Center, and this is our third exercise and cancer series that we're doing. We've been doing this for the last 3 months, and there was a lot of requests on upper body lymphedema for breast cancer. We're a month away from Breast Cancer Awareness Month. So, and we over the last 2 months, we've had pretty good responses from our audience about the exercise video. But no matter what we talked about, whether it was balance and fall, or weight loss or general exercise, we do find that one thing that interests people most is lymphedema in the breast. But there are quite a bit of information about lymphedema that I feel many individuals in the community have misunderstanding and myths about. And the risk of lymphedema and the suffering from lymphedema very often prevents a person from getting good breast cancer treatment. In fact, it's somewhat, we're worried about delaying treatment because patients are concerned that they're definitely going to get lymphedema if they go for breast cancer surgery. So I'm just going to, I have Eleanor with me again from to teach us a little bit about exercise for lymphedema. But before we start, I would just like to give a little bit of introduction to lymphedema so that we can have some good information. I'm going to share screen now. Okay. So this is basically some introduction on lymphedema. Lymphedema and breast cancer. In fact, actually, we work very closely with our physiotherapists and occupational therapists with special training in lymphedema. And that would be the first thing that I like to share about this issue of lymphedema. Because with lymphedema, sometimes the cause is actually due to cancer. Most of the time, if we are facing lymphedema in clinic, these are patients who have had surgery done quite a long time ago. The difference between lymphedema due to active cancer versus lymphedema due to previous surgery in a patient with no cancer is not difficult to distinguish. In fact, your medical oncologist or a doctor can get an ultrasound done or a scan. A physiotherapist and occupational therapist can help to assess that lymphedema. But when a physiotherapist and occupational therapist see a patient with lymphedema, they generally would like to know if this lymphedema is associated with active cancer, because the management and the treatment is very different. So we work with any individuals from the OT with lymphedema special training, but we mainly work with our OT department and Parkway for lymphedema management. And when seeking assistance in lymphedema, when you meet people and you say, oh, you know, I've got problems with my swollen arm and I'd get some help, it is best to just see if they've got special experiences and training in helping cancer patients, because we would not want any of our patients to seek advice from individuals who have no experience in case they manage patients with active cancer the same as they manage patients with no cancer. So basically, in terms of lymphedema, let's just start with a little video that we've done in the past to help understand what is this concept called lymphedema. Li Fang, thank you.
Every breast cancer patient's needs are unique. Breast surgery involving lymph node removal may result in impaired lymph flow and drainage. If fluid builds up over time, Swelling known as lymphedema occurs. The swelling can be at the chest, armpit, and/or arm areas. If there is persistent or unusual swelling beyond 2 weeks after surgery, you may have lymphedema. Some suggested landmarks for any signs of swelling. Make a fist in your left and right hand. Compare both hands. Are the knuckles equally prominent on both sides? Is there any puffiness around the knuckles on the affected arm? Stand in front of the mirror. Bend both elbows. Are the elbows equally prominent on both sides? Is there any puffiness around the elbow on the affected arm? Check for signs of swelling in the breast, chest, and arm on the affected side. Does the affected arm feel heavier or fuller? Here are some simple exercises that can help you regain full motion if you're experiencing stiffness and tightness around these areas. Gentle movements such as neck rotation, shoulder rolls, hand pumps, and wrist rolls are some of the exercises you should do to promote lymph flow. However, do not overdo these exercises. Always check if the wound has healed and consult your therapist or surgeon before embarking on any exercises. Cuts, burns, grazes, and bites on the affected area can lead to further swelling. Here are some guidelines to help you protect your affected arm and hand. Your therapist can advise you further. Use alcohol-free moisturizer. Use electric shaver. Use gloves. Use sunscreen. Do not use blades and hot wax. Do not go saunas and hot baths. Do not have heavy massage on the affected side. Do not take your blood pressure on the affected side. Do not receive injections on the affected arm. Deep breathing encourages lymph to flow back into the blood circulation by changing the pressure in your abdomen and chest. At CanHope, we customize rehabilitation support to suit individual needs and administer proper therapies to those who require help. Always remember to ask for a doctor referral to gain a better understanding of your needs. For a more comprehensive treatment conducted by our trained therapists, call us at our hotline +65 6738 9333 or drop us an email at enquiry@canhope.org. You may also visit our website today at www.canhope.org.
Thank you for that video. So the video was short, but those who didn't catch it in front, we will be replaying this entire webinar on our Facebook. Please visit us at our Facebook page, Parkway Cancer Center, and the last two videos as well as this will be replayed for the next few months. So I just would like to introduce this concept of lymphedema and how it started. First of all, we are talking about upper body lymphedema. The concept of lymphedema, as you have seen in the video, essentially just means that there is slowing of lymph drainage from any part of the body. In fact, our entire bodily system depends on our heart that pumps fluid around the body, and the whole body needs to receive the heart needs to receive fluid coming back from the body, and that comes through two channels. One channel is the venous channel, and the other one is the lymphatic channel. The lymphatic channel is otherwise also, of course, well known to be associated with the immune system. So, which is why if we had cuts and we had infection, the lymph nodes in the region that is draining that area, like for example, if my arm may get swollen because that's where the bacteria can harbor and be destroyed. So the original surgery that was described by Dr. Halstead in 1894, now this is more than 120 years ago, was called a radical mastectomy. This radical mastectomy, as you can see on this illustration on the left, was a extremely monstrous surgery where at that point in time, no one knew anything about chemotherapy, medications, or any treatment for breast cancer. They just knew that if there was a tumor, the surgeons would come and remove it, and they would try and remove the lymph gland underneath, as many as possible, as the muscles. This was associated with extreme loss of arm usage and stiffness and swelling, especially from lymphedema, because if they were to go in and remove so-called quote unquote all the lymphatic systems, then there is no way that we could drain any lymph fluid back from the arm. So that will lead to, of course, stiffness and swelling. And of course, if the arm is already swollen from the lymphedema, that leads to more pain, more loss of arm usage, and therefore, of course, worsens the lymphedema. Later on in the 1940s and 1950s, analysis of patients who had whole state mastectomy versus modified radical mastectomies, it was found that actually these extended radical mastectomies did not prove to be more superior compared to what they call the standard modified radical mastectomies. So this type of whole state radical mastectomy has not been performed, I dare say, in the last 60 years. They've always been called MRN, or modified radical mastectomy, where not all the lymph glands are removed. Definitely the muscles aren't removed, and it's just the breast, and some affected lymph nodes are removed. So this is the history of how lymphedema started. Already before the webinar started, someone asked this question, that she had done surgery in 1997 and she had lymphedema resulting from that surgery. Is this still correctable? I would have to dare say that even in 1997, the surgery that she had undergone would not have been an extended radical mastectomy. It would have just been a modified radical mastectomy, but a number of lymph nodes, if they were affected, were subsequently removed. So what is the function of the lymph nodes? Of course, the function of the lymph nodes is actually to drain the lymph back, or the fluid back, from the peripheries, which is our hands or our feet. And you can see on this system, this diagram here on the right, that's all the lymphatic systems that we have in our body. So lymphedema is not limited to the upper arms. If I had surgery in my groin, or if I had surgery in my abdomen and there were enough lymph nodes that were removed, we can also get lymphedema in the lower limb. There will be a separate webinar on lymphedema on the lower limb, because it's a different set of problems altogether. So upper limb lymphedema, 75% of the lymphatics from the breast drains through these lymph nodes called axillary lymph nodes. Axillary lymph nodes would be otherwise known as the armpit lymph nodes. So when we say axillary, we actually mean armpit, the lymph nodes in the armpit. And of course, it can drain through others, such as internal thoracic, so on and so forth. But if you can see from the diagram, majority of the lymph must pass through the armpit lymph nodes before it gets to the rest of the body. So this photograph is a very unusual photograph of a patient that was operated many, many years ago. And this is what we used to see. And fortunately, nowadays, we almost never, I have not met a patient with such severe lymphedema, I dare say, for the last 15 years, unless they had surgery done 20, 30 years ago, and it was left untreated with multiple infections, multiple problems, and it was left untreated till it reached this level. But this is almost unseen. So in 2017, in fact, this doctor who's a surgeon, Dr. Broly, looked at the hazard ratios, or independent predictors of lymphedema. And of course, the number one was armpit lymph node dissection. What does that mean? Armpit lymph node surgery versus sentinel lymph node surgery. Armpit lymph node surgery Usually when the surgeons say, I'm going to go in and remove, quote unquote, all the lymph nodes, what they mean is that they were going to go in and assess if there are lymph nodes that are involved with the cancer. If it is, they would be removed, and that would be called all. But in this day and age, in the last 10, 20 years or so, generally surgeons do not touch the armpit and remove all the lymph nodes. We have more than 50 lymph nodes in our armpit. They definitely do not remove 50. The maximum they remove is probably no more than 20. And the number of lymph nodes that we find in the armpit in the final surgery would be dependent on, number one, what the surgeon did, and number two, how diligent the pathologist is in sitting there counting the number of lymph nodes. So generally speaking, in Singapore and in Asia now, we generally remove no more than 15 to 20 in an extreme case. We therefore still leave approximately 20 to 30 lymph nodes left in the armpit, and that's why we don't see lymphedema that much. But the more popular surgery now is called this thing called the sentinel lymph node, where if the tumor was small, there would be some procedure that would be done to determine which lymph node guards this part of the breast. And that will be called the sentinel lymph node. The definition of sentinel means this lymph node guards this area, therefore I only remove it. If it's not affected, then the rest of the lymph nodes do not need to be touched. So the ability to perform a surgery with sentinel lymph nodes is dependent on the size of the tumor. The smaller the tumor, the more likely sentinel lymph nodes can be recommended by a surgeon. The larger the tumor, the more advanced the cancer, the less likely a sentinel lymph node surgery would be recommended. Therefore, the number one factor in reducing lymphedema would be to detect breast cancer early with mammograms, self-breast examination, ultrasounds, such that we can pick up breast cancer at the absolute earliest stage. That is the number one way of reducing any possibility of lymphedema. So the rest of the, if there is no other take-home message, the number one take-home message is tell your friends and tell yourself, if you're not a patient, the number one way of reducing lymphedema would be to go ahead and get the breast cancer diagnosed early with early screening and go and see a surgeon as soon as possible if there was any suspicion of breast cancer. And I could generally pack up and go home and not give the talk anymore if all our patients manage to do that. Unfortunately, some cancers are more aggressive. When it's found, it's already a little bit later. So they require chemotherapy, the full chemotherapy, AC plus taxane chemotherapy, which is a typical chemotherapy, followed by nodal irradiation. All these have also a high risk of getting lymphedema, but clearly not as high as the number of lymph nodes that was removed. The other thing is the incidence of lymphedema had also increased significantly as body mass index increased, meaning the larger a person is, the higher the risk of lymphedema. And generally that comes from just overall water retention of an individual in a whole body. It's not just limited to the arms, it's the whole body. So if the whole body was heavy and waterlogged, then essentially the lymphedema would be worse. So in this particular study, patients with a body mass index of less than 25, which would still be considered as obese in Singapore, had an 8% risk at 5 years, whereas those with body mass index more than 35 had a 17.1% risk. Therefore, the best protection against lymphedema would be early detection and weight control, which we have plenty of time to do. So the original staging and the grades of lymphedema based on the WHO expert committee on filariasis, that's a parasite infection. Why would they use a parasite infection to stage lymphedema? Because for breast cancer treatment nowadays, it is almost rare for us to see severe lymphedema. We see maybe stage 1 or grade 1 or grade 2, maybe just grade 3 for patients who have had surgery done many years ago, or they had radiation, or they had multiple infections of the arm. But it is more typical to see severe lymphedema in patients who actually have parasite infections of the lymph nodes, such that this swelling can never be treated, no matter what we do. So just to go through a little, stage 0 is the lymphatic vessels have sustained some damage, but it's not yet clear cut. So lymphedema is not obviously present, but our patients can tell us, hey, my arm feels a bit numb, a bit stiff. Doesn't feel as limbo as the other arm. You know, I'm generally right-handed, but now I feel that, you know, my left hand where the surgery was done feels very heavy, or vice versa. And I just feel that it's just not right, and my rings don't fit so well. So it's not obvious to the people that are looking at them, but it might be obvious to the patient. Stage 1 is swelling increases during the day and disappears overnight as the patient lies flat in bed. So when we lie flat, generally the water that we have goes back into our heart and we pee it out and it's gone. Stage 2 is swelling is not reversible overnight and does not disappear without proper management, meaning without a good massage. Now, I know that the previous video shows do not do extreme massages on their arm. What we mean is do not seek a masseuse in the community where they massage for you know, muscle relaxation, sports massage. You must see someone with occupational therapy and lymphedema management, because all this can be managed by a professional. Stage 3 is rare. Swelling is irreversible, and usually the limbs or the affected area becomes increasingly large, and the tissue is hard and fibrotic and unresponsive. And these are the patients who may need to consider reconstructive surgery, and the surgeons who do these are the vascular surgeons. There was a question from a lady who had surgery done in 1997, and she said, is this irreversible? It depends on how bad the lymphedema is, and it depends on how willing she is to go through reconstructive surgery. So a vascular surgeon may be able to give some advice. Stage 4 is where the size and the circumference of the affected limbs becomes noticeably large. Lumps, bumps, or protrusions on the skin begins to appear. This is usually extremely rare, and infection itself becomes a high risk, meaning it's not the infection that causes the stage 4 lymphedema, but the lymphedema itself leads to very friable skin. The skin becomes very fragile, very, very thin, and it itself, if we just knock it, there might be a risk of infection. This is very rare. So we generally try and prevent this from happening to any one of our patients. Extreme stages, as you can see here, does not happen to breast cancer patients. So don't let these photos scare you and say, oh, wow, you know, if I go and have surgery done in my lower limbs or in my arms, this is going to happen, because no, extreme stages are never seen in breast cancer. They're only seen in parasitic infections in Africa. Not to be saying that in that region that this is very common, but parasite infections, chronic parasite infections, chronic fungal infections, or genetic conditions where individuals have a genetic absence of lymphatic channels in the lower limb, then this can happen. Patients can become handicapped, severely handicapped, unable to perform independent daily routine activities. But I'll just put it straight here, this does not happen to patients with breast cancer. So what can be done if there is any suspicion of a lymphedema? Well, education first. So if we had a patient who had surgery done and many lymph nodes are affected, the surgeons and usually the breast care nurse would have already given much advice about the prevention of lymphedema. Don't have cuts, don't have infections, try not to do too much activities like, you know, simple things like prawn peeling. If a person is a domestic goddess or a homemaker and she loves to peel prawns for her family, she needs to wear gloves to protect that arm, not to use razors or any risk of getting cuts. And of course, regular gentle massages, regular exercises, all this can reduce the progression of the lymphedema and of course, weight control. Once a person is diagnosed with grade 1 lymphedema, compression can be considered. Garments can be worn throughout the whole day but can be taken off for sleeping. Elastic compression garments can be worn. And these are professionally fitted. We can't be too tight and can't be too loose. If it's too tight, it will affect the blood supply to the fingers. If it's too loose, then it's not going to work. So it needs to be fitted properly. And these gloves can be very expensive. So again, prevention is better than cure. So what about surgery? As I mentioned, for some patients who have very severe and very chronic long-standing lymphedema, there's been a number of surgical methods that has been tried, but some have shown to be not so effective because it means reconstruction. And reconstruction itself requires some lymph to be working to permit wound healing. We have sent a few patients for vascularized lymph node transfers. We've had some patients who have had a very good response, but like I said, it is a series of surgery. It is also associated with a number of complications. But if there are some patients in this audience right now who says, I've got very severe lymphedema and I'd like to seek a second opinion for vascular transfer, then do let us know. We'll hook you up with a vascular surgeon. You probably need to take some time to make a final decision as to whether this will be worth your while. And of course, no matter how bad this lymphedema is, there can always be a professional OT that can help to massage and see what's the problem behind this severity. So we're going to answer a few frequently asked questions here. These are evidence-based advice for patients following armpit surgery. So basically, what happens when a patient has bilateral mastectomies if they were incidentally found to have bilateral breast cancer, they need to have bilateral lymphedema, lymph node surgery. Are they therefore at risk of developing bilateral lymphedema? And if they had to have chemotherapy, what would they need to do? For patients who have undergone bilateral mastectomy with armpit surgery, generally we would advise them not to have any peripheral plugs for chemotherapy. They would have to go for a porta cath or a central line. Is it safe to fly after axillary surgery or armpit surgery? Clearly it is. There is no evidence to show that there's any increased risk related to the number of flights or the duration of the flights, but it is also still advisable to carry a prophylactic compression garment. But some studies show that this can get really tight and it's counterproductive. So it's better to get up in the plane and walk around a little, just like we would for our lower limbs. But it is safe to fly after armpit surgery. Can women shave under their underarms after armpit surgery? Definitely can, but we would prefer that we use clipping method and less invasive method, because a manual razor or an electric razor can still have a risk of injury. So you might need to get that professionally done. So there are many methods using non-invasive, non-blade kind of hair removal that would be more safe. And of course, permanent hair removal is definitely safer than shaving. But if you were desperate and you needed to shave, well, just be extremely careful. Can patients have blood pressure measured in the treated arm? Well, we tell it to all our patients. We do it for all our patients. We never check the blood pressure on the arm of the armpit surgery. But technically speaking, if we looked at studies, there is no clear evidence that this can prolong lymphedema or worsen lymphedema if we did blood pressure on that arm once every 3 to 4 months. But if it's continuously done throughout the whole day, for example, if a patient was in ICU and they needed their blood pressure checked continuously for the whole day, then we will not put it on the affected arm. It is really all about the risk benefit. If I had to take blood pressure on that arm, if I did it occasionally, it'd be fine. Can patients have blood tests, intravenous cannula, immunizations on the treated arm? Generally speaking, any puncture can act as an entry point for infection. Therefore, it is advisable that we don't do any procedures, intravenous cannulation, injections, or blood tests on the treated arm. But if we again look at proper studies, retrospective studies, there might have been a little bit of recall bias, meaning most individuals in that study had actually remembered that they had a skin puncture in that arm before the swelling came up. So I've spoken to most of our surgeons, definitely for sentinel lymph node biopsy, not the full axillary clearance, with a patient who has no lymphedema, although it's preferable to consider venipuncture and siting of a venous cannula on the non-affected arm, if we're really, really desperate, a simple blood take by a professional, experienced phlebotomist can be done on the affected arm if we're really desperate. But again, it is a general refrain, but it is not an absolute taboo, especially if it's a sentinel lymph node. But if a patient already had lymphedema, first of all, it's impossible to find any place to take blood or to site a venous cannula. So the problem itself has already prevented us from doing any procedures on that arm. But if there is no lymphedema, studies have shown that it is safe, but we try not to. So it's a refrain rather than a taboo. So what about nutrition, weight loss, and lymphedema? Once this lymphedema has set in, that means if we have patients with severe lymphedema, as you can see in the photo that I shared on one of the first 2 slides, that lady is very slim, but the lymphedema has already set in. Then the studies have shown that active weight loss did not result in a significant decrease in the lymphedema. But if it was a patient who is newly diagnosed, newly had surgery, was a little bit on the heavier side, keeping a lower processed sugar and a lower caloric diet was compatible with maintenance of a normal BMI, reducing obesity, reducing water retention, and therefore may alleviate or prevent the symptoms and signs of lymphedema. But of course, a low calorie does not mean a low nutrition. We must keep a diet adequate in protein and vital minerals and essential vitamins through a diet and a good nutrition and not supplementation that will also alleviate the symptoms by reducing the possibility of obesity. We need to maintain a good diet, a good nutrition, low in sugar because sugar can cause water retention, but we need the minerals and the vitamins to keep our metabolism good. We need that vital protein to reduce that third spacing of water retention. All this goes very far in reducing lymphedema. A few more slides on this. Sorry, I can't see the. What about exercise and lymphedema, which is the main key issue here? In patients, these are all well done studies. I highlighted the ones that was actual randomized controlled studies. But in those with lymphedema or at risk of developing lymphedema following breast cancer treatment, resistant training did not increase swelling and decreased, in fact, in some patients. And there are many potential beneficial effects on cardiovascular health. Why I put this here is because most of us would tell our patients, if you've had surgery done, don't carry heavy weights on that arm. What we mean by heavy is don't carry any weight that you can't deal with. So we have patients who are homemakers who needs to go buy groceries without knowing that they were putting extreme stress on their arm. They stop exercising, but they then carry 10 kilo rice on the affected arm. Of course, that's going to cause pain, swelling, etc., just like the same thing for the other arm. A person who has never done any running suddenly goes out and runs 10 kilometers will get leg swelling. This is a normal part and parcel of breaking down the muscles and healing and swelling. Moreover, resistant training and other forms of exercises were not associated with an increased risk of developing lymphedema who had previously received breast cancer treatment. In fact, they randomized unaffected at-risk patients with greater than 5 lymph nodes removed to routine care or exercises. Fewer women in the exercise group developed lymphedema. And that's new because I normally would see patients who will come and tell me the surgeon said cannot do exercise on their arm, but that's not true. We can do careful exercises, but do check with your surgeon and your doctor before you embark on any exercise, because the fitness trainer that you train with may not have any experience in breast cancer patients. So it's better to check with the surgeon. How heavy can you carry and in what kind of order? The physical activity and lymphedema trial randomized 141 women with lymphedema to weight training or routine care, found no change in the arm volume between the cohorts. And in fact, an additional meta-analysis, was where they collect many studies together of aerobic and resistant exercises supports the benefit of exercises in at-risk or affected survivors. But the take-home message is patients should start slowly with light weights and few repetitions, increasing it gradually and stopping if it becomes uncomfortable. So the take-home message is lymphedema of the arm after breast surgery is less frequent with earlier detection and less advanced stage cancers. Keeping good nutrition and reducing obesity is associated with less risk of lymphedema. Exercise and the use of the affected arm is encouraged, but individuals must know the limit. You must know yourself. If it causes discomfort, then that's not right. You need to slowly build up. Compression bandages and manual massage can treat advanced lymphedema, but again, prevention is better than cure. Talk to your doctor and lymphedema specialists if you have lymphedema issues. but you can always do exercises at home to improve the symptoms. For those patients who have already got very severe lymphedema, a vascular surgeon with experience with lymphatic channel transplants may be able to give you some advice about doing such a surgery to improve on the lymphedema that is already set in and very severe. So with that, I'm going to stop sharing this and we're going to go on to the exercise portion of this.